Welcome to the Momentum Health 2022 Benefits presentation brought to you by NMG Benefits. Let us first understand where NMG fits in.
NMG is an authorized financial services provider and is here to help you with your medical scheme membership. Our consultants are fully accredited with the FSCA, the Council for Medical Schemes, and your medical scheme. As one of the largest financial services intermediaries in South Africa, with more than 25 years of experience, we can assist with various elements of your medical scheme and provide you with sound, independent advice.
This video highlights and summarizes the various options available in 2022. Our agenda covers the components of the medical aid, gap cover, and we delve into each option more closely. Let's move on to an overview of the components of your medical scheme: hospital cover, chronic cover, and day-to-day cover. Hospital cover is the most important element of your medical scheme. Hospitalization is unlimited on all options at Momentum Medical Scheme. The actual rate at which you're covered for treatment in hospital will vary based on your plan choice. This rate is reflected as a percentage of your scheme rate and will increase from 100% cover to a higher percentage depending on your plan choice. Planned hospital procedures need to be pre-authorized with your medical scheme by contacting the scheme on 0860 117 859. Your doctor may do this on your behalf or may give you the necessary codes and descriptions to obtain the authorization yourself. It is recommended that members carry their membership cards with them at all times or download the digital card. Members on certain plans may need to make use of network hospitals in the case of planned procedures. Please be aware of the day surgery network, where certain procedures must be performed in one of the designated day surgery clinics to take advantage of the reduced co-payments. Momentum Medical Scheme gives members the opportunity to choose between any hospital or associated hospitals on the extender, incentive, and custom options. Choosing associated will result in a premium reduction, and members must make use of an associated hospital network for planned procedures. Use of non-network hospitals on the associated, Evolve, or Ingwe plans will incur a 30% penalty co-payment on the hospital account. It is becoming more important each year to consider taking out gap cover. Gap cover is a short-term insurance product which can be purchased separately from your medical scheme and is an effective way to ensure that you're covered for hospital shortfalls. These shortfalls arise because there's no forced regulation on provider charges. Medical schemes may only cover up to a certain rand value, and/or your medical scheme has co-payments and deductibles. Gap cover will assist in covering the resultant in hospital shortfalls. Please contact your NMG consultant to discuss the gap cover options available to you. Let's move on to your chronic cover. All plans cover for medication relating to 27 chronic conditions, which are paid from risk. Certain plans have an additional list of chronic conditions that will be covered, so it is important to understand this before you consider a plan change. By way of example, higher costing plans include cover for certain mental illnesses such as depression. A plan downgrade will result in the member having to pay for this medication from day-to-day benefits instead of the chronic benefit. Should you be diagnosed with a chronic condition, it is necessary for your doctor to contact the scheme to register your condition under the chronic benefit. This will ensure that your treatment and medication relating to the condition is covered by the scheme and will not affect your day-to-day benefits. Each plan has a chronic medication list known as a formulary to guide members on which medications are available on their plan. If you choose a medication that is not on the formulary, a co-payment will apply. Please chat to your doctor about the possibility of changing to a formulary medicine to avoid this shortfall. Momentum Medical Scheme offers 3 provider choices, namely any, associated, and state. Members who have chosen any have the freedom to use any pharmacy and get their script for chronic medication from any GP. Members who select Associated must make use of MediPost as their designated service provider and obtain their script for chronic medication from an associated network GP. We generally advise members who do not have any chronic condition to select State, as the State network on this option allows the member to take advantage of the reduced premium. Members on the Ingwe option must make use of the Ingwe Primary Care or Ingwe Active Network. Members on Evolve will need to make use of State facilities. Please note that chronic medicine formularies differ based on your provider choice. Day-to-day cover. All Momentum Health members have access to comprehensive screening through the Health Platform Benefit. Health Platform benefits are paid by the scheme up to a maximum rand amount per benefit. The scheme must be notified before you use the benefit. Members on the Ingwe and Evolve options only have these benefits available to them from their chosen primary care network provider. Ingwe and Evolve offer primary health care through network providers. Members do not have access to a savings account. Momentum offers members a choice of 2 hospital plans, Custom and Evolve. No day-to-day benefits are available on this option. The incentive option offers members a 10% savings benefit to cover day-to-day medical expenses. Members on the extender option have a rich savings account. Once savings are depleted, they will be subject to a self-payment gap where claims will not be refunded by the scheme. Once the above threshold level is reached, additional benefits will be available to them for day-to-day expenses in the above threshold benefit. Now that you have a better understanding of the key components of your medical scheme, let's take a closer look at the options that are available. The Summit Plan is a traditional option which covers hospitalization at any private hospital at 300% of the Momentum rate. Extensive chronic and day-to-day cover is available from any provider. Day-to-day cover is paid from a risk benefit subject to an overall day-to-day limit of 28,000 Rand per beneficiary. This is a combined limit incorporating both day-to-day cover and cover for 36 additional chronic conditions. The extender and incentive options provides private hospital cover at 200% of the Momentum rate. Members have access to medication for 62 chronic conditions on extender and 32 on incentive. Day-to-day expenses are funded from savings on both extender and incentive, with extender offering an above-threshold benefit once savings are depleted and members have paid through their self-payment gap. The custom option is a hospital plan offering cover at 100% of the Momentum rate. A co-payment of 1,640 Rand is payable for most admissions. Members have access to medication for 27 chronic conditions on the disease list, but no day-to-day benefits are available. Members have the option to choose their hospital and chronic provider networks across the extender, incentive, and custom plans, and will enjoy premium reductions as a result. The Evolve option offers members private hospitalization at 100% of the Momentum rate. Members must make use of network hospitals in the case of planned procedures. A co-payment of 1,640 Rand applies to all admissions. Members have access to medication for 27 chronic conditions on the disease list. However, this is obtained via the state network. Members have a choice to make use of the Healthsaver to increase their day-to-day cover even further across all these options. Healthsaver is a complementary product offered by Momentum that lets you save for medical expenses. The Ingwe plan provides unlimited hospitalization at the agreed rate depending on the chosen network, and contributions are income dependent. Members have access to medication for 27 chronic conditions on the disease list. Benefits are only available from the Ingwe Primary Care Network or Ingwe Active Primary Care Network depending on the member's choice. Day-to-day cover can be obtained from the member's Ingwe Primary Care Network provider. Members on this option also have access to the Healthsaver Benefit. The Healthsaver is a savings vehicle which can be used to pay for additional healthcare expenses. Members are able to contribute a monthly savings or opt to deposit a lump sum into the Healthsaver account. They're also able to redirect contribution savings from provider choice discounts into the Healthsaver. Accumulated funds in the Healthsaver can be used to pay any healthcare-related expenses such as co-payments, cosmetic surgery, vitamins, and even monthly medical aid contributions, provided you have accumulated sufficient funds to do so. Momentum also have access to the Multiply Visa card, which provides members with immediate access to their Healthsaver funds to pay providers instantaneously, as long as funds are available in the card. Healthsaver provides members with access to funds immediately to pay medical providers such as doctors, pharmacies, and even veterinarians. In 2022, members may use their positive Healthsaver balance to donate access to a GP visit to anyone in need by buying a Netcare Plus voucher online with a Multiply Money card. The health platform is a comprehensive set of benefits offered to all members on all options. Benefits are dependent on plan type. These benefits do not affect the members' day-to-day benefits and will be paid from risk. These benefits include early detection tests, preventative care, a helpline, maternity program, disease management programs, and an international travel benefit. Members are reminded to pre-notify the scheme before making use of these benefits. Let's take a look at Momentum's wellness and rewards programs. Multiply is a comprehensive loyalty program encouraging members to be healthy and active, and in return offer them rewards for their efforts from various Momentum partners. Members begin on bronze status and accumulate points towards platinum as they become healthier and more engaged in the program. The higher your status, the higher the rewards. Some of the partners include Virgin Active, Planet Fitness, Pick n Pay, Dischem, Fly Sapphire, Macro, and more. As a Multiply member, you're able to get cashbacks and discounts when you shop at Momentum's cashback partners. These cashbacks accrue interest in your Multiply Money Savings wallet. You're also able to deposit money into your Multiply wallet to top up your savings. You have access to these cashbacks whenever you need them. The different ways to spend these cashbacks include mobile payments, send money to friends who have Multiply Money, shop online through Multiply, swipe your Multiply Visa card, or transfer money to your Healthsaver account if you have a Multiply Visa card. Multiply Premier for 2022 has been refined to make the program more relevant and easier for clients to engage with. Some of the enhancements members will be able to enjoy are online fitness assessments. Members will be able to do their assessments when and where they choose to, and these online assessments will be valid for 6 months. Members will now be able to earn a monthly win of 125 Rand in the form of a partner voucher, if they've earned 4 consecutive weekly wins. Some new activities have been added to help members to earn more points, such as getting the COVID-19 vaccine or doing a digital stress score. Health returns. Know your status by having the necessary health assessments done. Be physically active and track your fitness and earn active days. In 2022, health returns will be payable per 630 Rand of your medical scheme contribution from January to August and 665 Rand from the 1st of September 2022. Reward values are up to a maximum of 3,000 Rand per family per month. From next year, through integration with Multiply, clients will be able to increase their health returns earnings by 2,400 Rand per family per year. Multiply Premier main members and partners who have achieved their newly introduced monthly wins benefit, at least a level 3 fitness result, and have been fully vaccinated against COVID-19 will be able to convert their monthly wins into cash, paid into their Healthsaver account. For further advice or assistance, you may contact NMG at one of the numbers provided.
Although we make every effort to get things right, there may be times when you feel that you have not received the level of service you are entitled to. In such instances, please refer to our complaints procedure, which can be downloaded from our website www.nmg.co.za.
We thank you for taking the time to watch this video and get to grips with your benefits for the new year. Keep well and stay safe.